In this video, we will discuss about RMC-7977 selectively inhibit RAS in the PDAC tumors. So before moving into the today's topic, we will understand this pharmacology of RAS dependence that we have discussed in the previous video. Here I have said that this panel E and F data are from the different mice model, but these data, that is panel D, E, F, and even the C data are from the same mice models. And here what they are trying to say is that the EC50 levels for the PDAC tissues are low, it is around 321 nanometer, whereas EC50 levels for the colon tissues are high, around 3205 nanomolar. And similarly, the EC50 levels are high for the skin derived from CDX tumor mice bearing, that is at around 1096 nanomolar, indicating that the KPC-997 selectively targets has a more selectivity towards PDAC tumors or PDAC tissues uh, compared to the colon tissues or the skin tissues. That is, it is more selective towards the pancreatic cancers. So after understanding that from the pharmacology of RAS inhibitions that it is more selective towards PDAC tumors, they wanted to further validate those results using some more experiments. So uh, here we will, here our discussion will continue of this pharmacology of RS dependence at different time intervals and at different dosage and at uh, different sites and observing the effect at different site. So in the panel A, what they did is they used the KPN1 cell line derived xenograft in the tumor bearing mice model and checked the apoptotic markers such as the CC3 at different sites. And in the PDAC tumor sites, they see that more CC3 levels compared to the compared to the CC3 levels at colon site and skin cancers. And they observe a peak of the CC3 markers at this 8 hours and with a dosage of 50 milligram per kg. And these things are quantified in the panel B, where we can see that the CC3 markers increases with RMC-7977 treatment at different time intervals, and it reaches at its peak level at 8 hours, where the increase in the CC3 markers are statistically significant compared to the vehicle in the tumors, that is PDAC tumors at different at a different dosage. It is 10 milligram per kg, 25 milligram per kg, or 50 milligram per kg. However, when we check the CC3 markers at other tissues such as colon and skin, we do not see a significant increase in the CC3. This substantiates their point that RMC-7977 selectively targets the tumor tissues rather than the normal tissues. And after validating their results on the KPN1 CDX device tumor mice bearing models, they did the experiment on the KPC FC mice bearing models also. And here also they found the similar results but at different time intervals. That is, at the tumor site, they see the increase in the RMC-7977 and it reaches its peak at a 4 hour with injection of this 50 milligram per kg of RMC-7977. Whereas simultaneously at the colon site, they do not see a significant increase in the CC3. And these things are also quantified similar to the panel A in the panel D, where we can see that at a 4 hour after injection of this RMC-7977 at different concentrations, we see that it observes a peak at 4 hour intervals, and after that it goes down. However, at the 12-hour intervals, we can see that peak is the increase in the CC3 is statistically significant compared to the vehicle. Whereas when we see its counterpart, that is at the colon skin tissues, we do not see a significant increase in the uh, CRISPR is in the cleaved caspase 3 markers. And this there is some slight increase at the 24-hour intervals, but this is not statistically significant. So this further substantiate their point, or this evidence further validate their point that is RMC-7977 selectively targets the tumor. After that, after validating this apoptotic marker, that is CC3, they also checked some different markers, that is the cyclin A2, which is necessary for the proliferations of the cells. And here also they find the expected results, that is in the case of tumors, the cyclin A2 levels goes down, that is proliferation of the tumors goes down at 24 hours intervals, at 24-hour intervals when it is injected at 50 milligram per kg. Whereas in the colon, they do not see, they see that recovery of these colon tissues observed at around 24 hours. Whereas in the case of KPCFC, the recovery is not observed at 24 hours. Whereas in the case of colon tissues, the recovery is observed at 24 hours, where we see the uh, cyclin A2 levels are close to the normal levels. And these things are quantified in the panel F, where we see that in the case of tumors, there is a decrease in the cyclin A2 level at after injection of the RMC-7977. It reaches to its lowest value at this 24 hours. After that, it increases. Whereas in the case of colon, we also see a decrease in the cyclin A2 levels, and it reaches its lowest value at 12 hours, but by the time it reaches to 48 hours, we see the recovery in the colon tissues. So recovery in the colon tissues is quite faster compared to the tumors, indicating that this RMC-7977 has more selectivity towards the tumor tissues than the normal tissues. So this is what they wanted to make. This is what they wanted to make a point, that RMC-7977 is more selective towards the tumor tissues compared to the normal tissues. If you need to understand more about these experiments in detail, you can go through the reference that is provided in the description. That's all for this video. Thank you for your time.